Assalamu alaikum doctors. In this video I am discussing a recall clinical. So I enter into the room and the examiner telling do the musculoskeletal examination of this patient pGAL. So as usual I wash my hand introducing myself. Hello, I am Dr. Ima, one of the doctor in this hospitals. Then I am taking the permission from the mother. I am to examine Ali. Ali is here 11 years age old boy. So after the permissions I am looking at the Ali as my task is pGAL MSK. I am questioning the screening questions. So, do you have any pain, any muscle, joint, and bone? Do you have any problem in going upstairs and downstairs? Do you have any pain, any problem in dressing, undressing, buttoning, and unbuttoning? So, after three questions, okay, I will first look at the child that he looks like there is any device attached, distress, dysmorphic features. I noticed that on the forehead there is some skins are like cigarette paper like. Okay, that is I am noticing. Then I tell the child, can you please stand? So he will be stand. I expose any socks, shoes, everything has been removed, and that child has exposed from the mid thigh by the help of mother or the child. Then I sit, look at the child leg from in front behind, inspecting the leg. I find there is genu recurvatum, hypermobile joint and pes planus. Okay. Then I go to the back. I see the child will be bent and his scoliosis present or not. So there is scoliosis or lordosis. Scoliosis present or surgery, scar mark can be present. Then I come back. I tell him touch the floor by hand. I'll show him how to do that, and he is doing that. He is hypermobile. I discovered that. Then gate, I tell the child, can you walk to the door and come back with running? So he do that. After that, he'll walking, he'll tiptoe walking and heel walking. I show him and he will do that. Then I am going to lie down on the couch. I measure the limb length discrepancy. After that, I am going to inspect the child is up to mid thigh exposed, inspecting any leg thing, any scar mark, and then I notice on the knee joint there is some skins are bruises, and also there are cigarette paper like. So I understand from that it is hypermobile, that is cigarette paper. It's going to be Ehler danlos syndrome. Then I tell the child patellar tape I do both the knee joint. Then I am going to bend the child. I tell him to bend, please. He bend and take to the abdomen, to the leg. So he bend and take this, and another leg also do. After that I adduct and abduct the knee joint and internal rotation, external rotation, both right leg and left leg doing. Then I am going to the ankle joint. I am showing him to do the eversion, inversion, and dorsiflexion, plantar flexion. So the child done that. After lower limb examination, I tell the child, can you please sit down? So he sit down. Then after that, first I expose from the mid shoulder by the help of mother. Okay, and then I first inspect the hand. Is there any asymmetry, hemihypertrophy, skin, elastic skin, noticing cigarette paper like skin, I notice anything I look. After that I tell him palm to palm, that is hemihypertrophy and also limb length discrepancy present or not. Then make a star, make a fist, then the metacarpophalangeal joint squint and prayer sign, anti-prayer sign. Then put the hand above the ceiling behind the neck. Okay, then then neck movement are right side look at, left side look at. Touch the ear, the right shoulder, left shoulder. Then the chin I will tell touch the chest and to the up to the ceiling. Then the three finger inside the mouth. Then I tell her the neck, pull the neck. Because Ehler-Danlos syndrome I find hyperelastic, and it is really confirming that it goes to Ehler-Danlos syndrome. Then these are the examinations. I would like to complete my examinations because full and also hypermobility I need to check there. The small finger, the thumb finger, and extend the elbow. These three also I do. So after that positive finding, I would like to ask the mother about it is a family history present or not, because it is an autosomal dominant disorder. So I will be then my presenting case today examining Ali. Ali is an 11 years age old boy. He is well communicating. There is no any distress device attached, and I find that his positive finding he is hypermobile. His Byton score is positive. He has skin bruises like cigarette paper skins present, hyperelastic skin. And also I notice the mouth, I can, there is pes planus, scoliosis, lordosis present or not, and high arched palate I find. So putting together, it is a case of Ehler-Danlos syndrome. Okay. Can I manage this child? So first for management, I will, what are the types of Ehler-Danlos syndrome? There are 10 types, okay. Classical severe form, they are hypermobile, they are vascular rare, okay. So I want to after examination, I will take the history, I revise my note already what investigation done or not, and then I will run some tests and involve the multidisciplinary team. So the test I involve investigations, what we do here. Genetic study we can do because it is an autosomal dominant conditions. We can do the child about scoliosis present, so spirometry, geometry we can do, and we can extract the spine we can do, and heart ECG echo as they have a heart condition associated. So these are, and multidisciplinary team I will involve for them. That is first genesis is involving occupational therapy, physiotherapy, lies with the school, psychological support to the family, cardiologist. These are we are involving, and I am giving some advice like first of all that is stretching, hypermobile exercise, stretching exercise maintain. Then also they will appropriate shoe wear if pest planus, avoid trauma, avoid contact sports because easily bruising, avoid hot weather. So avoid contact sports, avoid hot weather. Then these are any physical classes, PE present or not, hot related symptom, bleeding problems they have present. So this is all about Ehler-Danlos syndrome, which is comes on MSK examinations. pGAL we find that. Thank you.